Hey guys, Dr. Childs here. Today we're going to be talking about the thyroid medication, sustained release T3. That's its name. It's actually also goes by the name SRT3. So if you've heard of that before, it's the same thing. So sustained release T3 or SRT3, there are two different names for the same thyroid medication. And this is an unusual thyroid medication in the sense that it's a little less common, okay? And doctors may not be familiar with it. But it does have some useful applications. And so as a thyroid patient, you should be aware that this is a potential option for you. And in fact, with all of the NDT recalls, the difficulty in getting certain thyroid medications, it's becoming more and more attractive and maybe one of the first choice thyroid medications for a lot of patients, especially in the coming year or so. So if you don't know me, I'm Dr. Childs. I'm an internist. I specialize in treating patients with thyroid problems, helping people with hormone imbalances, and of course, helping people lose weight. But today we're talking about SRT3. And that is in relation to the thyroid. So I want to give you the basics of SRT3. We're going to compare it to the other formulations of T3. We're going to talk about dosing. We'll talk about who should use it, how do you get it, and so on. So let's start off with some of the basics here. So SRT3 stands for sustained release T3. Now, what it really is it's a way of binding T3, which is the strongest and most powerful thyroid hormone, to something, in this case, usually cellulose or methylcellulose. What it does though is it takes a little bit of time for your body to break this bond here and then to absorb the T3 into your bloodstream. Okay, so you can imagine that's your bloodstream and it gets in. But so you swallow it, usually a capsule, and it comes bound to this thing which kind of holds on to it. It takes your body and your intestinal tract a little bit of time to break that bond, and then the T3 gets into your body. That's why it's called sustained release, because it takes a little bit of time. So if you take one SRT3 capsule in the morning, it'll give you a relatively constant T3 level throughout the remainder of the day. And this has some benefits, especially when we're going to talk about multi-dosing in just a minute here. But how does this compare to what I refer to as immediate release T3? Now, immediate release, or IRT3, as I'm abbreviating them here, include really two medications, but there's more, but we'll talk about them in just a sec. So cytomel and levothyroxine, okay? These are both T3 only medications, and I'm referring to them here really just as IRT3 because they're just the standard or stock standard thyroid medications that contain T3, and they are absorbed faster than sustained release T3. So they're not really immediate release in the sense that they're getting into your body within minutes of you consuming them, like some medications are. But they are IR compared to the sustained release version. So that's why I'm giving them that designation for the purposes of this video. And they, again, include medications like cytomel and levothyroxine. Cytomel being the brand name, levothyroxine being the generic. Now, both of these medications are the same in the sense that they both contain T3, which again is the very important thyroid hormone. They just differ in how quickly they are absorbed into the body. And as I mentioned, that does have an important impact on how you feel when you take the medication and which one you should start with. And this will become clear as we talk about it. So in one of those ways, we can talk about dosing. So most people, when they try T3, they end up doing what's called multi-dosing throughout the day. And by the way, if you are somebody just taking levothyroxine or Synthroid, a lot of this may be going over your head. So I would continue with the video, make sure you watch it, maybe rewatch it, because these are all really important things if you are a thyroid patient taking any sort of thyroid medication. But most thyroid medications, at least the one you're aware of, including like Levo and Synthroid, these medications are taking once per day, right? You wake up in the morning, usually first thing you take it, and then that's it. That's because this has a long half-life. So what it means is it stays in your body for a very long time. In fact, usually on the order of weeks. So if you take something in the morning, if you take your thyroid medication in the morning today, let's say 4 weeks from now, some of that will still be in your blood. Okay, that is not the case with T3. T3 is rapidly used. So what happens is when you consume T3, I believe it peaks in the bloodstream after just a couple hours of consuming it. So that means it's really only in your body for a couple hours, or at least at the level that you want it to be. So what thyroid patients know this, so do some savvy doctors. So what they do is they say, okay, well, I'm going to take T3 several times per day. I'm going to take it in the AM, I'm going to take it at noon, I'm going to take it at 2 p.m., and then maybe at night, right? So you have what's called multi-dosing. Now, if you are a thyroid patient, you know that it can be difficult to take thyroid medication because you're not supposed to eat or drink anything after it. You can't take supplements after it. So this can kind of actually be somewhat difficult to get on a good schedule, especially if you're using the immediate release version of T3. So sustained release T3 comes in and says, hey, if we take it once in the morning or once, an AM PM schedule, once in the morning, once at night, you don't have to do all these multi-dosing throughout the day. Now, I'm of the opinion that most people don't have to multidose anyway, but that's just based on my experience. There are lots of people who will tell you you have to. Again, I don't necessarily believe that, but if you're somebody taking it and you're struggling getting all of your supplements in, eating, drinking, etc., having coffee, whatever it is, then SRT3 may make a lot of sense for you in this situation. So it does play an important role in dosing. One question I do want to answer before we move on is, how do you get it? So again, if you're a thyroid patient, you're hearing about SRT3 for the first time, you're probably thinking, okay, well, where can I get it? It is not available over the counter, so no OTC. You must get a prescription, that's what this RX is, from your doctor. Now, more than that though, this isn't a prescription that is going to be at a regular pharmacy, okay? So this is not going to be at a CVS or a Walgreens or, I don't know, a Walmart, whatever the ones are. Whatever the stock standard pharmacies are that are just the big box pharmacies. That's what I'm talking about here. You will not be able to get this medication there. It must be compounded, which means you have to go to a compounding pharmacy, okay? So a compounding pharmacy is a special type of pharmacy. They're all over the place though. It's very likely that there's one in your town, especially if you live in a bigger city. And these pharmacies can make medications to certain specifications, okay? So they can change what things are bound to, they can change the inactive ingredients, they can make a medication more clean for you if you're real sensitive to certain things. So they're really valuable. Standard doctors really do not use compounding pharmacies. In fact, I never used it when I was in training, in residency as an intern or anything like that. Doctors aren't trained to use compounding pharmacies. It wasn't until I got out that I was like, wow, there's a whole new world available to me that I had no idea. And it's pretty exciting if in that way. But you must get it from a compounding pharmacy, which means it's usually difficult to get from your conventional thyroid doctor or endocrinologist unless they're already aware of this sort of thing. But you can actually just Google compounding pharmacies near me, and it'll populate. You'll be able to see what's near you, and then you could call them and say, hey, do you get a list of doctors that prescribe using them, and then you can go to those doctors. So that's a little hack that you can use to get good thyroid doctors. But anyway, you will need a doctor who's willing to work with you to prescribe it, and you'll need to get it from a compounding pharmacy because it has to be specialty made. So the next thing I wanted to cover is who should use it. So SRT3, if I was going back in time maybe 4 or 5 years ago, SRT3 certainly wasn't my favorite thyroid medication. In fact, I would sort of use it as I wouldn't say last resort, but it was, several down on the list. I almost always prefer the IR versions of T3, provided the patient can handle it. So if you are somebody who cannot handle it, SRT3 does become very attractive. And so it'll make a little more sense as we talk about what type of people should use it. So one of the reasons that you might want to switch to SRT3, and this includes if you've had this issue with any type of thyroid medication, are those people who have experienced heart palpitations on T3, or I'm going to add here T4. Some people do get heart palpitations taking levothyroxine. And a fair amount, maybe 15-20% of people experience heart palpitations using liothyronine or Cytomel. And again, that's because those medications are absorbed much more rapidly than the SRT3 is, and they can sort of flush your heart or flood it, and they can hit on those receptors on your heart in the cardiac myocytes and activate it. And that can feel like a heart palpitation. You'll actually feel your heart beating. Now, it's not dangerous or anything like that, but a lot of people don't like feeling heart palpitations because they get very uncomfortable about it. So if that's the case, not lowering the dose, but changing it how quickly that dose gets into your bloodstream throughout the day usually solves that problem. So if you've had that problem, that's one way to fix it. Another reason would be if you feel jittery or anxious when taking forms of other thyroid medications, but mostly T3. A lot of people who do take them, they tend to get a little jittery. In fact, I kind of refer to it as a nervous energy, because it's not so much that it really feels bad. It's like, I'm actually getting so much energy that it's a little overwhelming. But it's not a terrible sensation necessarily. That can be solved usually just by slowing down the amount of T3 that you get throughout the day. You can also tweak the dose, but SRT3 is a potential solution to that as well. So another group of people do get high blood pressure when they take forms of Cytomel or liothyronine, and SRT3 is a way to get around that. So again, that comes from the fact that if you take too much T3 all at once, it rushes into your body, it gets on the heart, causes the heart to bump harder, and that increase in force of contraction can increase your blood pressure. So it actually isn't uncommon for people's blood pressure to go a little bit higher once they take T3. And again, if you just slow down the absorption of that T3, it'll slow down the force of the contraction, or at least the overwhelming of the cardiac receptors, and it will at least manage your blood pressure in that way. Another reason to do it is if you had trouble with the multi-dosing. So again, it actually can be difficult to manage your schedule, especially if you are, imagine that you're at work. I mean, you got to get your T3 out 4 times per day. That can be a little bit difficult. When do you eat? When do you take your other meds? How many supplements are you on? Do you need iron? Do you need calcium? These all impact that. So if you had trouble with the multi-dosing before, this would be a reason to use it. Let me put that up here. Another reason would be that you have, or another reason to use it would be that you do not have any intestinal issues. Now, I failed to mention this before, but one of the downsides of using SRT3 is that it works, but only if your intestinal tract can break it down, okay? There are many people, especially thyroid patients, who have intestinal issues, meaning their intestines are not working as well to absorb nutrients as healthy other people or people that are otherwise healthy. And if you take SRT3, you might not be getting as much as you think you are. So imagine you're taking, let's say 50 micrograms, just to make this easy, of SRT3. Well, what if you have intestinal issues? You may not be absorbing 50. Instead, you may be only absorbing 25 micrograms. So you're getting half of the effective dose that you're taking, swallowing by mouth, because your stomach has a hard time breaking it down. That's a real issue. In fact, converting between doses from IR to SR is not just 1-to-1 as you might think. So if you're on 5 micrograms of IR or Cytomel and you want to switch to SRT3, you may need double the dose to get the same amount of T3 into the body. So that's something to consider. Okay. Another group of people who would want to use this would be those people who are interested in weight loss. Now, T3 is the best medication for sure for helping thyroid patients lose weight. Now, the reason for that is, again, it's the most powerful medication. So it gets in, increases metabolism, and improves a lot of factors which can help you with weight loss. So if you're interested in weight loss or having problems with weight gain, any form of T3 would be ideal, but SRT3 included. And then lastly, I'm putting down here those who have failed IRT3. So if you've taken Cytomel or levothyroxine and you just can't get it to work no matter what your dose is at, no matter how many times a day you try to take it, whatever it is, you're just not feeling well on it, that's a reason to try sustained release T3. Now, the cool thing is I've had plenty of people between all these medications that you can almost always get somebody on something that works. I don't think I've had any one person who has failed every single thyroid medication available. I'm sure that, one person out there is going to say I have, and it does happen, unfortunately. But most people between compounding medication, switching from Cytomel to levothyroxine, switching from levothyroxine to SRT3, using a combination of all these things, you can almost always find something that works well for you. So just remember that. You can switch back and forth or, as you need, and you may need to do that. So I wanted to at least introduce you to this idea of sustained release T3. It doesn't really get a lot of, at least I don't see a lot of information out there on the internet on it, but it is an important thyroid medication. And if you have thyroid problems, something you should be aware of. So I want to hear from you guys. Have you used sustained release T3? Did it work for you? Leave your comment and your experience below because I want to hear about it. And by the way, if you haven't already, make sure that you download my free thyroid PDF resources. I have tons of information. If you like this sort of stuff and you have thyroid problems, you'll love that information. It's all free. You can get it at the link below. And it's all designed to help you feel a lot better if you have thyroid problems. So that's all I have for you guys today. And otherwise, I will see you in the next one.